Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, board certified clinical specialist in geriatrics, and the founder of Balance and Fall Support Group in Aging Adult. I am here right now with you for our Thanks God It's Thursday. Every Thursday, we always interview and highlights innovators, entrepreneurs, PT innovators, entrepreneurs, and academicians. So we get to know them very well. And tonight, for our Thanks God It's Thursday, we have Dr. Becca Jordre. I need to practice the last name too. So we'll get to know her more. And she is a PhD, doctor of physical therapist, and also board certified clinical specialist in geriatrics. She is also professor in University of South Dakota and also the doing a research in senior athletes, and we will going to talk about more about that. She's the secretary of the Global Health in Aging Adult Academy Physical of Therapy Association as the special interest group. All right. So let's get to know Dr. Becca. How are you? Thank you so much for your time.
I'm good. Thank you for having me.
You are welcome. So tell us more about yourself. We talk about your as a physical therapist, as a professor, and can you tell us a little bit like how many years now you are as a physical therapist and as a professor? The transition on how you do that. Thank you.
Sure. Um, so I started PT school in 1999, and there were only 4 programs that were at the DPT level then. So I was in the first year that Duke University um, had a DPT class. That was our class. So we were definitely the guinea pigs for DPT. And I think the next year there were like 35 programs, but I had always thought maybe I would teach someday. And I thought, well, if I get my doctorate right away, then that's a good thing. So I sought out a DPT program when I was just out of undergrad. So I graduated Duke in 2002, and I practiced in northern Minnesota in a little town called Bemidji, which is still near and dear to my heart. And I practiced in an outpatient setting there until 2007. And then I spent a year in central Minnesota, sort of on a pilgrimage, getting closer to my parents and my husband's parents, and landed ultimately in Vermilion, South Dakota, which is where I took on a faculty position. Probably a little bit blindly. I always knew I wanted to teach. I don't think I knew exactly what I was getting myself into when I did that, but it has been fun ever since. And I've been here in Vermilion since 2008. So I had my youngest child in 2008. So I sort of gauge he's turning 14 next week. So I guess I've been here for about 14 years.
Wow, 14
Yeah.
years. That's really amazing. So sometimes we really don't know that we're heading on that academician point, but all of us as a physical therapist from the beginning, we're already an educator, right? Every time we're teaching our patients, this is what you're going to do. It's the same thing. But what do you think, Dr. Becca, do you think is the skills that we as a physical therapist need to improve if we want to be an academician or a professor, just like you?
Oh, wow. Um, al- Almost all of us do research. And I think there's a lot of patience in doing research and uh, precision in that. And that is certainly an area that I've learned to appreciate. Very different, maybe the than always the way that we practice. Our practice is a little bit of an art and a science as well. Um, yeah, I think a big part of me being an academician is probably also been not losing my clinical mindset as well, and reality with how my students are going to practice. I
Yeah.
think that part is super important. And so as you get into, the the teaching faculty research, world, where we're kind of never stops. I think it's important that we still remember what we're doing and who we're producing as our PTs, so that I still practice and I still try to practice what I preach and make sure I don't lose touch with that. But I do think our teaching skills, if we're good teachers in PT, that does translate to how we can teach our students, but there is more. There's more to learn.
That's
and
really
I think we have
interesting.
to do continuing education to be good teachers. This is the same as we do to be good PTs. Yeah.
Wow. Yeah, I believe patience, right, is really different. And
Yeah.
also, do we need to do a certain course to transition from a typical clinician to an academician point? Or because in Philippines, for us to teach, we need to pass the board exam for teachers. So I'm not sure how the transition here in America, if I will be going to teach in a certain university. So how
Mhm.
does it work here?
Interestingly, at the collegiate level, technically, no, right? So we can teach if we've been trained as DPTs. My university recognizes my DPT degree as a terminal degree, and I could come in and teach with that. My program asks that I also have board certification. CAPD expects us to have something more advanced than what our students have. So right away when I came in 2008, I got my GCS, so that I was at another level, a step above where the students were that we were teaching. And then sometime later, I went on just recently, actually, and finished my PhD. And that was a good experience. Not required by my university, but CAPD, as CAPD criteria are changing for accreditation of programs, the expectation is that a greater percent of faculty now have their PhD or have an academic doctorate beyond their DPT. So I think we'll see more and more of that expectation that it's going to be an EDD or a PhD if you're planning to spend some time going into academia.
Yes, I've noticed that because I have many colleagues right now in an academy. They have the EDD and also the PhD. And
Mhm.
then majority is doing also research because that's part of your PhD, right? Speaking of research, you love older and aging adults, and tell us more about your research and why the senior athletes. And thank you for your all contributions and all research about that.
Okay. So you'll have to cut me off because this is my favorite thing to talk about. Um, it actually probably helps talk about my transition to academia. I developed what we now call the senior athlete fitness exam. Really in the early stages of my time here as faculty, it was an opportunity for service learning for my students and a way to go out and interact with senior athletes in South Dakota, where I live and practice. And as I did that more, I realized we could study this population and then that could be my research. And so my research became less of a hindrance and more of an exciting opportunity. I've since created a great relationship with the National Senior Games Association. We have um, an agreement with that organization that every other year when they host their National Senior Games competition, which moves around kind of like the Olympics, right? We head out, myself and my students, and usually a lot of other students and PT volunteers, to conduct the SAFE on National Senior Games athletes. They love this service that we provide. We provide them with education associated with how they're doing physically, and through my research has essentially help refine this screen and create norms that are more appropriate to this like very active older population, who, by the way, I think is generally overlooked medically. Sometimes creates confusion when we see them in PT because they function at a much different level than our typical older adults or older adults who are in a state of failure, frailty, but they still have physical needs and they still really need our education and care. So my hope is that, as we learn more about them, we can also, them, but we can help them more. And
Yes, yes.
I will say, if you if you're in Florida or close to
Mhm.
Florida, we will be there May 9th through the 20th screening athletes. So if you want to come, I have an online sign up that I bet you Dr. Jenny will post. But
Sure,
that,
sure.
yeah, that is definitely something that, we're still getting volunteers for. And then in 2023, it'll be in Pittsburgh. So if you're in Pennsylvania,
Oh, wow.
that's an
Yeah,
opportunity for people there. Moves around typically every 2 years, but with the
every
pandemic,
2 years.
we missed 21. So we're doing the 21 games in 22. Yep.
Yes, and I believe you're working with my friends there in university in St. Augustine. So
Yes.
I think they're the one, and that is the Florida Physical Therapy Association. We have the director RV Vitente, Dr. RV Vitente, and also Mini is the chairman, and she's one of
Yes.
our volunteers as well. She talked about that. So I'm sure
Good.
those are your students and everything. So really great to have all the people around, and more people and clinicians are talking about senior athletes, and now we have the senior athlete fitness exam, especially
Yes.
Dr. Gio, Dr. Mindy. They keep doing those things, and Dr. Mike Studer as well. He talked about that he collaborated with you, so
Yes,
that's really
absolutely.
good. And then I think we need to learn more about that. How do we do the safe, and what are the resources? Where are the resources that we can get these things? Do you think you can share a little bit of that,
Yes, absolutely.
Doctor?
So,
Mhm.
so most recently, I think back in 2018, we established a partnership between APTA Geriatrics and the National Senior Games as well. So it sort of went from being just me and USD hanging out to, bringing APTA into it. And we're working right now on creating a toolkit so that people that want to do the safe toolkit seems to be the way to do things lately. So an online toolkit, so individuals will be able to access resources probably through APTA Geriatrics site, and the training that they need to go through the safe and then do that in their community. It's basically a battery of physical performance tests that covers cardiovascular health, strength, flexibility, balance, and mobility. And then we've created, as part of this toolkit as well, educational handouts that align with each area. It's a different group. So these aren't handouts or tools really that are appropriate for the general population. Or those that are ill. It's really intended for those that are already, meeting or exceeding their physical activity guidelines, but that maybe need some help and guidance in how to do that safely.
That's really important for us, because now that we're learning more about senior athletes, and I think I first because we have senior athletes, we have also Special Olympics. So
Yep.
these are more and more that we're doing it with different kinds of genre. So we have older adults, aging active adults. So when we say senior athletes, how can we simply describe them? Is there like age and then a little bit of characteristic?
Yeah. I actually like to call them older athletes because I think the word senior is kind of falling out of favor, but to qualify and compete with that organization, they have to be at least 50.
Oh,
So everyone that we've been testing and studying has been 50 plus. And I classify them as individuals who on average get double the recommended physical activity as purposeful exercise. So instead of getting 150 minutes a week, this group tends to get 300 plus minutes a week of physical activity. That's their average. Granted, some maybe do, a little bit less, and certainly we know some do more.
that's really nice to know, especially the age itself. And I didn't know that if we are able to do 150, they are double of that, the
Mhm.
characteristic. So that's easy to remember because they are more advanced. That's why they're athlete, you know. So
Mhm.
that's really cool. Thank you so much. So right now, of all the things that you did, research, I remember you're also a certified exercise expert in aging adults and also Mackenzie professional, so specialist. And what are the courses that you can share with us that really influence you in your practice right now, other than the things that I just said?
Yeah, so those are definitely big influencers for me. I think I went off on the McKinsey path right away out of college or out of PT school, and that helped guide how I saw spine and now even how I see extremity cases. Um, I do use the CEA course info for, man, we hopefully we all learned how to load better for strength training.
Mhm.
Um, and recently I would say I did a course, and this is maybe a little bit more maybe less foundational, but I did a course getting certified in blood flow restriction, and I think there's some potential there for our older athletes to do more, even if they're injured, and still improve themselves that way. um, yeah, I like anything that really helps me get to the root of the problem when I'm looking
Oh,
at
interesting.
continuing education, uh, maybe more so than, things we would apply, but
Mhm.
structures that we would go through. Yeah.
I like that. I did a CEAA as well, and really interesting. We can always apply. And I agree with the loading in strength training. Especially we have the white paper that I just shared in the Balanced Fall support group from Dr. Dale Favors. She emphasized everything about strength training and also the eyes. Dustin Jones has the wonderful also doing those things,
Yes.
the
Yes, I
modern
love his
management.
content.
Mm-hmm.
Yep.
Modern management of all the. I attended one of those, and then I practiced how to do deadlifts, and then said, I'm out of breath already. And they keep correcting my posture and everything. So that's really cool.
Yep.
So I keep learning about them because they were thinking older adults, even not physicians, aware that we can put loading on that, you know, and that's really cool. I like also the blood flow restriction. The Philippines Academy of Orthopedic just had a blood flow restriction webinar. So that's really increasing also the knowledge for everybody. So that's good to know. Thank you so much, Dr. Jordre. Can you tell us your specific balance and pulse exercise that you can share? We are being listened right now by many clinicians from Philippines, Middle East. I work in Saudi Arabia and UAE, and also here in the United States, we have many listeners. If they are physical therapists, what are your recommendation or your best physical therapy balance exercise that you can
Yeah.
share?
So probably my favorites would be dynamic exercises. I'm a huge fan of an obstacle course. I think it's fun. I think it keeps things interesting and challenging. And, you can take your time going through all kinds of different things without it seeming monotonous and repetitive. So, setting up some hurdles, setting up a Bosu ball and an Airex. And, one time in our clinic, we accidentally ordered a 6-foot long wedge that's like, imagine just like a little wedge that would hold you up in bed, right? But accidentally like super sized that. And I would have, patients walk up and down that thing. It was the hardest thing to walk on ever, but it just made working on balance reactions and different surfaces and widths and things that we would walk on more fun. So that's probably my favorite go-to. This week I've been doing with one of my
Nice.
gals a lot of dynamic lunges onto the Bosu and up onto the Bosu. I did had her do reverse lunge up onto the Bosu where she's stepping backwards, and that was challenging, right? But a good, I think, really good strength training and
That's
good
really
balance work at the same time.
That's really advanced. All right, very difficult, the both two.
Yep.
I keep using the top part and then the other part will be really challenging. Very seldom I have clients that can tolerate that. But an active aging will have more activities. That's really good. Also,
Yep.
another one is the blaze pads, right? So now the dynamic step and then the
Yes.
agility is really cool. So
Yep.
thank you. How about for our clinicians? Oh no, not the clinicians, the client itself. So what is your best tips for our
Mhm.
listeners? They are patients, they are caregivers listening right now. So what will be your tip for them to improve balance and decreasing risk for falls?
Right. So I do all those challenging things in the clinic, but I don't recommend that they do those at home, especially if they're challenged in their balance. I think, actually, things that I don't do in the clinic that I would encourage people at home to do to improve things would just be to work on their strength, right? If they can, if I think that's such a big thing for our older adults is that they need to work on strength. They need to have the muscle tone and the muscle mass to be able to do the things that they want to do when they get to PT or when they have the opportunity. So even strength training laying down or strength training sitting in a chair, if they can safely do something, holding on to the counter and putting, weights on so that they can do some strength training that way. Once you're up on your feet, doing strength training becomes balance training as well. But I always want people to be careful and not challenge themselves in an unsafe way at home. So I always feel like doing some of that, is good. It's good things to do when they're not with me in the clinic.
Yeah. So thank you so much. That's really wonderful. Strength training and then balance exercises. They go hand in hand. So guys, you got lots of tips there. And thank you so much, Dr. Becca Jordre, for all the tips and wonderful contributions that you're doing for our senior athletes and also the founding and developing the senior athlete fitness exam. So how can we connect with you? How can we contact you if we have any questions?
Yes. So I certainly live and breathe by my email. So if you email me, I'll get it. It's just my first name dot my last name at usd.edu. So becca.jordre at usd.edu. And that is actually right now the only way to get safe training as well. So we're working on getting that on APTA geriatrics in the future. But right now, if you email me, you can also go through the training through our university. So that's an option if you want to do it.
Wonderful. Thank you so much, Dr. Becca Jordre. And we really appreciate everything. Now I can pronounce it better. Your last
Great.
name because
You're
I
doing
heard it
great.
from you. I heard it from you. So I said wonderful. All right. Thank you so much, guys. That's Dr. Becca Jordre, professor, a researcher, an academician, and of course, a physical therapist by heart. So if you have any question, you wanted to volunteer, connect with us, and then definitely they will be in Florida this coming May. And after
Yes.
2 years, they will be in Pennsylvania, close to me. I'm from Delaware. So definitely maybe that's the time I can contribute that
Yes.
time. So I will look for that. So guys, if you have any question, connect with us, Balance and Fall Support Group, Physiogen PT and Wellness. You can DM us on our Facebook, or of course in our email. So it's me again, Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults. I'm the vice chair of the Global Health and Aging, and Dr. Becca Jordre is our secretary right now. So thank you so much. God bless you all and have a great day. Thank you, Dr. Becca.
Thanks, Jenny.